All right, traditional treatments, sometimes they don't quite cut it for those suffering from mental illnesses, leaving them feeling frustrated and alone. Well, the Centers of Psychiatric Excellence, or COPE, wants to end that suffering once and for all. Joining me now to tell us more about it is Dr. Michael Banov. Welcome, Doctor. Thank you so much for being with us.
Hello.
So appreciate you being here, and this is such an important topic. I'm glad we're diving right in. Let's talk a little bit first about what you do, what kind of medicine you practice and how you got started.
Sure. Well, thank you for the opportunity of being here. So I'm a board-certified psychiatrist. I treat adolescents, adults, geriatric patients, and I'm also a board-certified clinical researcher. So in my practice, we do clinical research trials, we treat patients, I lecture around the country.
Wonderful.
And I went to medical school here at Emory, but I did my training up in Boston at McLean, Mass General, part of the Harvard Medical School system. And now I practice here. I've been here for 24 years, and I'm on the clinical faculty at the Medical College of Georgia.
That is wonderful, and I want to learn a little bit more about the Centers of Psychiatric Excellence, or as I mentioned, it's called COPE. I'll refer to it as that going on forward. Talk about what you do there and how you're different.
So let me tell you a little bit about how COPE started. It was founded by medical doctors who have expertise in the field of psychiatry, and they're associated with one of the most prestigious medical centers in the country. And they decided that they wanted to really focus on providing innovative care, evidence-based, to people who weren't responding to standard therapies. So they decided to set up several clinics across the country, and we're fortunate to be one of the first centers of 4.
Fantastic. And let's talk about some of these new treatments that you are excited about now in this field.
So there are so many exciting things happening in psychiatry. For a while, most of the standard treatments were kind of Me Too's in a lot of the sense.
What do you mean by that?
So a lot of the medications would work in very similar ways to one another. We were sort of staying in a box. And now with this treatment that we're using, intravenous ketamine, which ironically ketamine is an old medicine that was used for many different things, but over the last 10 years, the National Institute of Mental Health has been conducting trials that have shown that it works in a number of psychiatric disorders, particularly those for those folks who are difficult to treat or haven't responded to standard treatments.
Right, and I know there's nothing more frustrating than trying something for a period of time, doesn't work, you keep trying, and nothing seems to be helping. So let's talk about the type of patients that will actually benefit from the most from the IV ketamine.
Well, sadly, 4 out of 10 people will suffer a psychiatric disorder at some point in their life, and a third of those are going to be resistant to standard treatments. So that's a huge number of folks who aren't responding to standard therapies. So intravenous ketamine has been shown in a number of studies conducted by the National Institute of Mental Health to be safe and effective for these. And actually about 2/3 of those who haven't responded to standard treatments have responded to intravenous ketamine.
Okay, and let's talk about the effectiveness. We've got some proof up there on the screen right there as to what it does and why this is something that has become so groundbreaking for you.
So ketamine works in a completely different part of the brain than standard therapies. It works in an area of the brain that's regulated by what we call glutamate. So we have areas of the brain that work through different neurotransmitters, serotonin, norepinephrine, dopamine. Most people have heard of those things. Glutamate's something completely different, and this is one of the few therapies that we have that really targets the glutamate area of the brain.
So then what will it do for us? We talk about the effectiveness, but how, let's say for when you go back to who is the best candidate for this, it was people suffering from depression, PTSD. How will it make them feel then?
Well, first we focused on treatment-resistant depression and found great results. We found that people responded 3 times faster than they did to standard therapies. And for those folks who hadn't responded, very high response rates and very rapidly within 1 to 2 days, which is really exciting because standard antidepressants can take 4 to 6 weeks, and that's if you find the right one.
Exactly. So just the fact that they are feeling better faster has got to be such a relief. And you say it's IV, so does Does that mean we go into an office and it has to be administered to us? Talk about how that would actually work.
Well, that's one of the exciting things about COPE is they've developed a protocol that's evidence-based with giving this intravenous medication in the office. There are other ways of getting ketamine, but they haven't shown consistent results. And what's also exciting is not just in areas of depression, but anxiety, post-traumatic stress disorder, which we know affects our vets, one of the most underserved populations, chronic pain, which has been leading to this opiate epidemic that we're seeing.
Absolutely.
So there's a huge range, but you really have to do it in a place that knows how they're doing it, that's following an evidence-based protocol.
Right. Why can't patients get this in a regular doctor's office? You know, a lot of people are probably listening saying, why can't I just call up my primary care physician and get this done?
Well, first of all, psychiatrists, who are the ones who are best trained to treat treatment-resistant psychiatric illnesses, their offices just aren't set up to give intravenous medications.
Exactly.
They either do counseling or give medications. So what's happened is people have been going to anesthesiologists or family doctors, and they may be very good at giving ketamine, but they don't know how to treat psychiatric patients.
Which is your specialty.
Exactly.
There.
So this is one of the few merging of these two areas. One is giving intravenous medication, learning how to monitor it, but by people who have an expertise in psychiatry.
And will the doctor at all be involved in the process? Do we need a referral? How does that work?
Well, we work really closely with the patient's primary care doctor, psychiatrist, counselor. You don't need a referral to call and see if you might be a good candidate for ketamine, but we really like them to be involved in the process.
Oh, I'm sure. Well, this is amazing information. Thank you so much for making us more aware of the great work that COPE is doing. And once again, make sure everyone knows where the centers are available.
Yeah, so there's 4 right now. There's New York, there's Charlotte, St. Louis, and we're very lucky to have one here in Atlanta to provide for the people here.
Thank you so much, Doctor.
Thank you.
Such a pleasure. And if you would like more information, please visit COPE. Call them right now at 833-COPE-NOW. That's 833-267-3669. Such important information. Thank you so much.